I'm Joe Condon. Welcome to our program. This week we are honored to have with us a gentleman from the Stratton Veterans Administration Hospital in the city of Albany, Dr. Manish Merchant, who is Chief of Primary Care at the Stratton VA. It is so nice to have you with us, Doctor.
Good morning. It's great to be here. Thank you.
For folks who are not familiar with the Veterans Administration and the Veterans Administration hospitals, could you briefly let them know what it's all about?
Well, our primary mission is to serve the veterans. And here in Albany, our hospital has 12 community-based outpatient clinics. So our catchment area goes as far north as the Canadian border, as far down as Kingston, and as far west as Sydney Bainbridge. And so we have roughly 50,000 unique patients that come through our center, and we have approximately 27,000 patients that are actually assigned to primary care providers in all those clinics.
And since it's the federal government being a federal program, this is not unique to the Albany area. It's all over the country where you would have this?
It's all over the country. The nation is actually broken up into VISIONs, which are Veterans Integrated Service Networks, and each VISION has multiple facilities which have their own outpatient clinics associated with them.
Now, the Veterans Administration always seems to be way ahead when it comes to the field of healthcare, and I understand you have a new program called Telemedicine, which is astounding in what it does to your veterans patients. Could you share with our viewers what that's all about?
Sure, I will. Let me first define telemedicine and telehealth. Telehealth is an overarching definition which includes telemedicine. When we define telemedicine, telemedicine is really the transmittal of electronic data to help benefit the veteran or the patient to help improve outcomes. Telehealth is actually broader than that, and it also includes patient portals, includes continuing medical education, and things like that. So here at the VA, we've actually started doing telemedicine back in the 1970s, really. Back in 1970, there was a first pilot program that worked with telemental health. And as we've progressed, in the last 5 or 6 years, we've really taken off using these modalities to help improve outcomes for our veterans.
Now, you were sharing with us today that the benefit of this program, if you have someone living up in Malone, New York, who needs medical care from the VA, that they don't have to come down to Albany or to the nearest VA hospital, they can get help through your program. How would that work?
That's correct. There are multiple services that use telemedicine at our facility. Primary care does. We have diabetology, we have cardiology, we have pulmonary, we have our kidney doctors. So all these specialists traditionally will see the patient the first time here in Albany. Mm-hmm. But for subsequent visits, they can be seen in their own community-based outpatient clinic. And so that will not necessitate the patient from actually having to travel down to Albany to be seen.
Okay, so what exactly would happen? Somebody is not feeling well, and they go to the outpatient clinic, and then what? Take it away from there.
Well, for the specialty clinics, a patient will come to the primary care provider, and the primary care provider would do the evaluation and say, well, based on what I see, you really need to see the urologist, or you really need to see the pulmonologist. We'll put a consult into our electronic medical record, which is integrated, so whatever I see up in Malone, I would see in Albany, I would see in Syracuse, I would see in Buffalo. So we're using the same electronic medical record. That consult will go to the specialist review it, and they'll contact the patient to schedule an appointment to go back to the CBOC for a telemedicine visit.
Okay, so I would go in there as a patient and sit down. Would I be sitting in a room, obviously with a television screen there, and you would be obviously in a room with the television screen, and you would be able to communicate one-on-one like I was in your office?
That is correct. The process in the clinics is that when the patient, first of all, we always make sure we get consent from the patient. We always ask the patient, would they want a telemedicine visit? If they don't, then we schedule a face-to-face visit.
Sure.
So we always make sure that they're comfortable, we tell them what's going to happen, and we have their consent to do so first. Telemedicine takes place over a very secure network. So we connect directly to the facility, so there's nothing else that goes on, or there's no chance that the video or the discussion that's taking place can be overheard.
It's not a Skype thing then?
It's not a Skype thing, no. It is on a secure network from our facility to the outpatient clinic. So when the patient arrives to the clinic, they're greeted by the clerk or the medical support assistant. They're the nurse or the LPN, or what we call the telehealth technician at the clinic, is alerted that the patient is here. The technician brings the patient to the room. We'll do vital signs. We'll answer any questions the veteran may have. We'll go into the records and see if there's any questions that they need to ask the patient. And then they'll let the provider know that the patient is there. Then the connection is made, and depending on the service, the technician either will stay there throughout the entire visit, or the technician will step out. The provider will go through, ask the patient questions of what's going on, and then using the equipment on the cart, the provider has the capability to look in the ears, do a skin exam, listen to the heart, and listen to the lungs. After which, we'll call the technician back in, review what the plan is, make sure the patient understands, and then that's the end of the visit.
Now, if someone is talking with you and you discover, whoa, this is something there's somebody better who can do it, and say the person's in California, are you able to access California right away and get them involved in it?
Unfortunately, not yet.
Okay.
Not yet. But that is the goal, that we will have a very strong network where there will be providers available nationwide for certain specialties where we'll be able to connect to them.
Now, you were, before going on the air today, you were talking about a doctor down in Florida who was involved with patients, and instead of being in Albany, they had to go to Florida, and they were still able, through your system, to do that one-on-one with the patients?
That is correct. One of the beauties of the VA healthcare system is we have an integrated medical record, so that if a provider is in any VA facility, by remote access, they can actually see what's going on in the other facilities. So we had a physician who was up in Westport, Elizabethtown, who lives in Florida. His mother's there, and because of her poor health, he travels back and feels the need to be there with her.
Sure.
But through telemedicine, we were able to have him continue to see patients and still be in Florida by using the services of one of the VA facilities down there.
How are the patients reacting to this new service? Is it some like it, some don't like it?
Surprisingly, most of them have really enjoyed it. Our telehealth technicians do give patients surveys at the end of the visit. And from last year's survey, the satisfaction survey, saying, how did you like the visit? How was the meeting with the provider? 92% of the patients said that they enjoyed the visit and would do it again. Initially when they come, many are definitely hesitant, not quite sure what's going to happen. But once the visit starts, as one provider says, it's amazing how quickly the screen kind of just fades away, and you're really carrying on the conversation with the patient.
What I find astounding is that you, through a television screen and the equipment there, are able to really do almost, it sounds like you can do a physical of someone by way of television.
And that is correct. For chronic disease processes, diabetes, high blood pressure, arthritis, cholesterol, telemedicine is a great modality for managing those issues. Definitely if it's an acute issue, an urgent issue, sometimes telemedicine is not the best, because I can't really feel, I can't touch, but depending on who's on the other end, they can be your hands to do that.
Yeah, I was going to ask you about that. Someone who might go in and think they're having a stroke or a heart attack, it doesn't work in that way.
Depends on what's going on.
Okay.
I mean, definitely we can do the EKG, and if we think we need to, we'll call 911, and the ambulance will come and take them to the nearest facility.
And how many facilities, is this nationwide right now?
This is nationwide. It's been a big push for the VA to implement telehealth, just because of where our veterans are located. In primary care, we had 5.2 million veterans enrolled in primary care nationwide. Of those, 40% live in rural or highly rural settings. So telehealth is a great way to get our services to our veterans.
As a head of primary care at the Veterans Administration Hospital in Albany, what are your duties?
My duties are pretty much administrative for the most part.
Right.
So making sure that all these 12 clinics function properly, making sure our teams here in Albany themselves function properly, and then I also do telemedicine. When there's not a provider there or there's an issue, I'm either traveling to the clinics or seeing patients by telemedicine.
I've had relatives growing up that were in World War II and used the VA services, but I've heard from your public relations person, Peter Potter, that the VA seems to be a big secret, and I've always been aware of it. That puzzles me.
It puzzles me too. We are actively going out and trying to increase our catchment and meeting with the veterans. We have fairs that we have. We go to the VFWs and try to let the veterans know that we're there. There's great things going on at the VA, and things have changed in the VA. It's not the way it used to be. We have primary care teams. We've actually moved toward the patient-centered medical home, which is what's called in the community. The VA uses the term called PACT, which is patient-aligned care teams. And the goal there really is to transition things from being provider-centric, how things were, to patient-centric, where the patient is at the center of the health care, to provide longitudinal care, not episodic care. Traditional care, you'd see your provider, you won't see him again for another 6 months, 8 months, nothing happened in between. The goal really is to see your provider now, and then in those 6 to 8 months in between, your team is still following you. It's still monitoring what's going on. Say if you're diabetic, have you had your cholesterol done? Have you had your eyes examined? What's your blood pressure? So throughout the continuum between those two visits with your physician, your team is following you.
How are they able to do that?
We have created, through the VA, because we do have such a wonderful medical record, we have reports that we can pull up that let us look at all our, say, diabetics.
Right.
And it'll tell us what their numbers are and who needs to be seen and when.
But if they don't check in with you for 6 or 8 months, how are you able to follow them? Are they on monitoring equipment?
Well, multiple ways. Nurses do contact the patients.
Okay.
And say, Mr. Jones, it's time for your eye visit. Or Mr. Jones, it's time for your colonoscopy. Whatever. We also have, as part of telehealth, something called a health buddy, a telehealth buddy. And what that is, it's a small little apparatus that goes to the veteran's home, and it's programmed for whatever's going on with the veteran. So if the patient has heart failure, there's a special module for heart failure. If the patient has hypertension, high blood pressure, there's a special module for high blood pressure. If he has diabetes, there's a special module for diabetes. And then there's also behavioral health modules. So if he's got PTSD or if he's got depression, there's special modules for that. So the veteran every day will get prompted by the health buddy to plug in the data. And some of these peripherals that we have are also, the data gets put in there automatically by Bluetooth, so the veteran doesn't even have to input the data. It's automatic. And at the end of the day, when he's done, he'll press a button, and by telephone, it gets sent to the medical center, where a registered nurse monitors that data to see how things are going. And if there's any red flags, they will contact the physician.
Telehealth buddy to have at your home, that is astounding. So you really are able to check on them all the time?
We can.
For folks that are veterans and watching our show today and are not involved with the VA, what would you suggest they do? How do they get involved?
Come down to your local facility,
right,
or to your local CBOC, and the staff there will direct them to the appropriate forms that they need to fill out, and they will direct them to either their veteran service officer or the veteran service center to help them get enrolled.
And you offer so many services, and you're taking care of veterans right now from World War II right through today, right?
That is correct. And not only primary care, we also offer specialty care. So we have surgical specialties, we have medical specialties, we have our behavioral health teams, we also have audiology, PM&R, a wide gamut of.
Now, my understanding is, and you can correct me if I'm wrong, that if you are a veteran, you are eligible for these medical services and you should take advantage of them.
The Veteran Service Center will help the veterans to see where they fall on their eligibility levels,
okay,
where they are, and then they will guide them to the appropriate clinic or the appropriate person for that.